teaching you how to give an IM injection to a patient, Mr. Olaf here. And before administering the medication, or any medication for that matter, we want to make sure that we verify the 6 rights. First is the right patient. So I'm going to get Mr. Olaf to verify his name and date of birth before I administer the medication. Mr. Olaf, can you verify your name and date of birth for me? Okay, great. The name and date of birth is correct. You also want to make sure you have the right medicine, dosage, and route, which we are going to be giving. This medicine in this particular vial, and just to make sure the dosage is correct, we want to calculate it based off his weight. So this particular medicine is 1 milliliter per 1 kilogram. Mr. Olaf weighs 2 kilograms, so we'll be giving 2 milliliters total of this particular medication. And the route is, like I said earlier, going to be IM, and we're going to particularly go into the deltoid muscle, which is on the shoulder. But you could also choose the lateral thigh or the posterior hip if you'd like also. Besides those 4, you also want to make sure you administer at the right time, which you would check on your MAR, and this is the right time for this medication to be administered. And you want to also have the right indication of the medicine, so this patient is being given it for the right reasons. Alright, and so next thing we're going to do is draw up the medicine from the vial, and by doing that we're going to pull back 2 milliliters in the syringe and inject it into the vial. Alright, and then we're going to pull back 2 milliliters. Alright, so now I have 2 milliliters of the medication in the syringe, and then just before I inject it into the muscle, I want to make sure I clean it with an alcohol swab real good and let it dry completely. And after I administer the medication, you want to make sure to observe for any adverse effects to the medication and document the reason that the medication is being given. So whether that's pain or nausea or whatever it may be, you want to make sure you put that into the documentation. All right, Mr. Olaf, I'm fixing to give you your medicine right here in your shoulder. It's going to be a big stick, okay? All right, 1, 2, 3. And you want to administer the medicine slowly. Doing great, Mr. Olaf. All right. And you want to safely recap the needle, just like so, and dispose of it in the sharps container. All right, Mr. Olaf, thank you.